Okay. Hey everybody, Dr. Rafich here from Vet Triage. We are continuing on with this issue of JAVMA from June 1st, 2015. We are talking about retinopathy associated with ivermectin toxicosis in 5 cats. There it is, and the study comes out of the veterinary school in Kansas State University in Kansas. It's more of a case series rather than a report. So the case description: 5 cats from the same household were examined because of sudden onset of tremors, obtundation, blindness, dilated pupils. The owner had tried treating the cats for suspected ear mite, Otodectes cyanotis, infestation by oral administration of a dose of ivermectin paste intended for oral administration of horses. So the cats got about 22 milligrams per cat. Half of the dose was administered into each ear canal. Clinical findings: all the cats were absent menace, dilated pupils, decreased pupillary light reflexes, phonic exam was normal, electroretinography was performed, and they showed B wave responses were diminished. 2 of the cats had toxicological assays, and they found that ivermectin was 450 micrograms per liter and 610 micrograms per liter. And for those who follow these types of reports, these readings, there they are. Those are the charts for them, and you can see them in the picture here as well. So these are representative ERGs, so electroretinograms, and B wave amplitudes, which is the height of the waveform measured from trough to peak, which are the dashed lines and arrows. They improved over time, which we'll see in this report, but this is what it's showing here. Okay. So treatment and outcome: all 5 cats made a complete recovery and were just monitored at home after being in the hospital for a few hours of observation. So median age of cats, 3 years. Median body weight, 4.3 kilograms. Neurologic examination revealed generalized body tremors, mild obtundation, and bilateral ear twitching, mydriasis in ambient light, which was diminished, meaning sluggish and incomplete, pupillary light reflexes, and then lack of menace response. The pupils of all cats were dilated with topically applied 1% tropicamide solution, a 20-minute dark adaptation period, and then the ERG was performed. Retinal responses were measured, and the median response values were 57.9 microvolts, which ranged from 37.1 to 93.6 microvolts for the right eyes, and 59.3 microvolts median response for left eyes, which ranged from 0 to 154.7. Values over 100 were used to indicate healthy retinal function in accordance with the information provided by the manufacturer of the ERG device. All cats were hospitalized, no supportive care, and 3 days after they were normal. Results of the toxicology reports found that ivermectin was found in excessive amounts, 450 micrograms per liter and 610 micrograms per liter. And I say excessive, but actually they didn't report any normal ranges. We'll get into that here in a little bit. There was no reference range available to indicate whether or not this was toxic range. Approximately 1 month after initial evaluation, the cats all had normal vision, and physical and neurologic examination was unremarkable. The electroretinograph was repeated, and B wave amplitudes were noticeably improved in 7 out of 8 eyes. So a median value of the right eye was 212.2 microvolts, which ranged from 148.9 to 251.7, and the left eye had a 151 median value, which ranged from 0 to 225.2. Okay, discussion. Reports of ivermectin toxicosis are common for dogs, less common for cats. The type of toxicosis has also been reported for equids, neonatal foal, adult horses, and miniature mule foal. Clinical signs include blindness, mydriasis, ataxia, lethargy, tremors, coma, and toxic exposure may result in death. Affected dogs may develop blindness without other clinical signs. Fundoscopic changes include multifocal retinal edema and folds with low-lying retinal separation with ivermectin toxicosis, a diminished ERG, B wave amplitudes. The Similar fundoscopic and ERG findings have been shown in another case report of a dog with ivermectin, and that dog was treated with intravenous lipid solution. In all three dogs, fundic abnormalities combined with diminished ERG responses suggest blindness of retinal origin. In contrast, ophthalmic and ERG findings were unremarkable in the mule foal that was reported. That suggests a central mechanism of blindness was associated with ivermectin toxicosis in that animal. So they're trying to differentiate between blindness that's coming from the eye versus the optic nerve versus the brain. Ivermectin, which is also 22,23-dihydroavermectin B1A and 22,23-dihydroavermectin B1B, is a broad-spectrum antiparasitic drug in the avermectin family. The drug enhances release of GABA at presynaptic nerve terminals, and GABA then blocks postsynaptic stimulation of adjacent neurons by acting as an inhibitory neurotransmitter, which causes paralysis and eventual death of target parasites, in which GABA acts as a peripheral nerve neurotransmitter. Ivermectin generally has a wide safety margin in most species in which it is used, except for young animals, such as foals and puppies, for which safety data is lacking. The drug must also be used in caution with certain breed dogs that have ivermectin sensitivity caused by a deletion mutation in the multi-drug resistant gene, or the MDR1 gene. The recommended dose for ivermectin to prevent heartworm in cats is 0.024 mg per kg or 0.011 mg per pound orally every 30 to 45 days. A commercially available ivermectin product for topical or oral treatment, oral meaning AURAL for the ear, for ear mites in cats contains 0.1 milligrams of ivermectin per liter, and the label instructions indicate a dose of 0.5 milliliters per ear canal, so 0.1 mg total dose per cat for kittens as young as 4 weeks old. But in comparison, the cats here received 220 times the recommended ivermectin dose via the transdermal route of a formulation that was meant for oral administration of horses. All right. Mechanisms underlying blindness in animals with ivermectin toxicosis are unknown. Previous findings suggest the involvement of intracranial and retinal processes. Gamma-aminobutyric acid, which is GABA, is considered the primary inhibitory neurotransmitter in the mammalian retina, and it plays an important role in processing visual information. If ivermectin were able to cross the blood-retinal barrier and increase the release of GABA, then retinal toxic effects could develop. In theory, visual impairment could result as the stimulation of retinal neurons, meaning the photoreceptor cells, bipolar cells, and ganglion cells, is blocked, and the biochemical process of phototransduction, in which light is converted to electrical signals within the photoreceptor cells of the retina, is disrupted. Abnormal ERG B-wave amplitudes detected in dogs and the cats in the present report suggest the hypothesis for blindness was of retinal origin in those animals. The cats lacked any fundoscopic abnormalities, but the small magnitude of retinal lesions in the dogs did not fully explain the severity of vision loss in those animals. So basically, it depends on the species where the blindness occurs. Fundoscopy and ERG should be considered complementary test modalities for assessment of blind patients, particularly when ivermectin toxicosis is suspected. Electrodiagnostic testing may help to identify neuroanatomic location of vision loss. Blindness of retinal origin related to photoreceptor dysfunction should be detectable as an abnormally low ERG response, whereas blindness due to problems elsewhere along the visual pathway, like within the central nervous system, should not impact ERG results. So yeah, very unique study, and at least the prognosis is good for those animals. But yeah, veterinarians have to watch out for dogs that have the MDR1 gene mutation, and so it's worth it to do a literature search on which dog breeds those are to make sure you don't recommend ivermectin to those dog breeds, because that can really be debilitating for them. All right, guys, we'll see you then in the next video. Thanks again.